to let it die. If you're aware of the feeling at all, you'll only know it as a little empty, insecure feeling, a feeling of not knowing what to do with your hands, or simply the feeling of, I want a cigarette. It's essential that you stop thinking of it as, I want a cigarette, and recognise it for what it is, your body withdrawing from nicotine. And if or when it comes, instead of saying to yourself, I want a cigarette but I can't have one, simply say to yourself, this is the little monster wanting its fix. This is nicotine withdrawal. This is what smokers suffer their entire smoking lives. This is what keeps them smoking. Fortunately, non-smokers don't suffer this little empty, insecure feeling of the body withdrawing from nicotine. Isn't it marvellous? I am a non-smoker, and so I'll soon be free of it, never to suffer it again. That way the withdrawal pangs cease to be withdrawal pangs and become positive moments of pleasure. That way it can be like when you leave the dentist. Your jaw might still have a slight dull ache in it, but that doesn't bother you in the slightest because you know it'll soon go. That part of your life is over. You're ready to get on with enjoying the rest of your life. Don't fall for the trap of thinking, just one cigarette. One cigarette would revive the little monster and create the need for another and another and another. Nicotine is an addictive drug, whether in tobacco or in the form of nicotine products, such as chewing gums, patches, nasal sprays, inhalators, or anything else. These substitutes simply prolong the addiction. It's like telling a heroin addict who's smoking heroin off foil to start injecting it instead. Nicotine addicts used to sniff powdered tobacco up their noses. It was called snuff. And in Scandinavia, they suck on small pouches of tobacco called snus to get their fix. Taking the drug in a different way just keeps you addicted. And don't use any other substitutes either, such as normal chewing gum, chocolates, sweets or biscuits. The empty, insecure feeling of the body withdrawing from nicotine is identical to the feeling of a hunger for food, but one does not satisfy the other. All substitutes make it more difficult to stop because they perpetuate the illusion that you're making a sacrifice. Do you need a substitute when you get over flu? Do you look around for another disease to take its place? Of course not. Don't worry if you find yourself eating a little more at main meals over the next few days as a result of a better appetite. Even if you do put on a few pounds, you'll find that once you've kicked smoking with this method, you'll be able to lose that weight if you want to. But you must not start picking between meals. If you do, not only will you get miserable, but you won't be certain whether or not you've kicked the cigarette. You'll have moved the problem rather than removed it. It's another form of substitution. The reason many smokers do put on weight with other methods is that they feel deprived and search for something to fill the void. With this method, you won't feel deprived, so you'll have no need to substitute. Don't keep cigarettes on you or anywhere else in case of an emergency. If you do, it means you're doubting your decision. You're a non-smoker. Non-smokers don't need cigarettes, and that's one of the great joys of being free. Don't try to block your mind from smoking. It doesn't work. Just make sure that when you do think about it, you're not thinking, I want one but I can't have one. Make sure you're thinking, great, I'm a non-smoker. If you follow those simple instructions, there'll be a moment over the next few days which you thought you couldn't handle or couldn't enjoy without a cigarette, and it'll suddenly dawn on you that it never even occurred to you to smoke. That's the marvellous moment when you realise you're free. But don't wait for it to happen or try to force it, because if you do, you'll create a phobia in your mind. All you really have to do is accept there's nothing to give up, make your decision never ever again, and get on with enjoying the rest of your life as a non-smoker. Life will soon go back to normal, and you'll accept that you're a non-smoker. But be on your guard.
Oh, I haven't had a cigarette in 6 months now. Guess one won't hurt.
The tobacco companies want to get you hooked again, and other smokers are always trying to justify what they know is their own stupidity and inadequacy. If your brain ever starts playing tricks on you by thinking, just one cigarette, remember, there's no such thing. Just one cigarette, cigar, or anything containing tobacco or nicotine, and you'll fall back into the nicotine trap. There's only one essential to remaining a non-smoker, and that's not to smoke. The moment you light a cigarette, you become a smoker again. So the question you need to ask is not, shall I have a cigarette? It's, do I want to become a smoker again? The answer is clearly no, because you didn't enjoy being a smoker, and you do enjoy being a non-smoker. That way, those moments can become pleasurable, as you congratulate yourself that you're free, and that way you can remain a happy non-smoker for the rest of your life. You're now free. Congratulations. Remember, every smoker would love to be in your position. Never doubt your decision. You know it's the right one. If you have any problems or questions, please contact your nearest Alan Carr clinic, details of which you'll find on the menu. You can now enjoy the rest of your life as a happy non-smoker. Goodbye.